Hello friends. Today we are going to discuss Jipmer Nursing Officer Previous Questions 2030 Part 4. First question. Expected date of delivery for a lady whose LMB was August 15th is. Answer is May 8, B May 22, C June 24, D June 1. So there are four options. So answer is May 22. So how we can calculate means our LMP plus 9 months plus 7 days. So we are calculating LMP plus 9 months plus 7 days. Then we will get May 22. Next, second question. Drug of choice of rheumatic fever is. So what is the drug of choice for rheumatic fever? A. Cephalosporin, B. Penicillin, C. Streptomycin, D. Gentamicin. So answer is penicillin. So rheumatic fever. Rheumatic fever means drug of choice is penicillin. Rheumatic fever and penicillin. Next is the best method to prevent food drop in a client on bed rest is to use. So a patient is there, patient is bedridden. So in order to prevent food drop, which method or which technique is more useful? Splints, blocks, cradles, sandbags. So which method is useful? Sandbags. So the answer is sandbag. To prevent food drop, we will use sandbag. Fourth one, Florence Nightingale was born on May 12th, 1820, May 12th, 1832, April 7th, 1820, June 7th, 1842. So answer is May 12th, 1820. So that day is, May 12th is the Nurses' Day. So May 12th, as we all know, May 12th. Then the year is 1820, 1820. Then next is the fifth question. Normal pH of blood is. Answer 7, B 7.4, C 7.3, D 7.5. Answer is 7. Next question, sixth one. Developmental task of adolescence is. So here they are asking developmental task of adolescence. Answer is A. Family versus peer relation, B. Trust versus mistrust, C. Identity versus role confusion, D. Initiative versus shame. So answer is identity versus role confusion. You can easily remember adolescence. So the child is transferring to childhood to adolescence age. So that time child will have confusion. So confusions about his or her identity and his what role she should perform or he should perform, whether to be a child or a adult. So that is identity versus role confusion. We can easily remember adolescence. Adolescence means it is a transference of childhood to the adult. So there will be identity. So there will be confusion of identity versus role confusion. So answer is the identity versus. So the seventh one, rate of chest compression in 1 person CPR. This is for adults. A 150 to 170 per minute, 120 to 140 per minute, C 60 to 70 per minute, D 80 to 100 per minute. Answer is 120 to 140 per minute. Eighth one, sequence of taking vital signs in a newborn infant is. Sequence of taking vital sign in a newborn infant is. Answer A. Temperature, pulse, respiration. B. Pulse, respiration, temperature. C. Respiration, pulse, temperature. D. Respiration, temperature, pulse. So answer is temperature, pulse and respiration. Answer is temperature, pulse and respiration. First we will see the temperature. Then we will go for pulse. At last only we will count for respiration. So keep in mind, last only we will count respiration. First temperature, next pulse and last one respiration. So TPR, temperature, pulse and respiration. Ninth one, the mineral element which is essential for synthesis of thyroxin. The mineral element which is essential for synthesis of thyroxin? A. Sodium, B. Iron, C. Iodine, D. Chloride. So answer is iodine. So A. Sodium, B. Iron, C. Iodine and D. Chloride. So thyroxin, the mineral element which is essential for the synthesis of thyroxin is iodine. 10th one, neonatal reflex elicited by touching the cheeks of the baby is. So neonatal reflex elicited by touching the cheeks of the baby is A. Moro reflex, B. Rooting reflex, C. Startle reflex, D. Sucking reflex. Answer is sucking reflex. So neonatal reflex elicited by touching the cheeks of the baby is sucking reflex. 11th one, deficiency of which of the following vitamins causes pellagra? So pellagra is caused by which vitamin deficiency? A. Folic acid, B. Vitamin D, C. Vitamin B12, D. Niacin. So answer is niacin. So pellagra is caused by the deficiency of niacin. Then 12th one, another term for superego is. Answer A. Self, B. Ideal self, C. Consciousness, D. Subconsciousness. Answer is consciousness. Answer is consciousness. So another name for superego is consciousness. So the 13th one, pacemaker of the heart is A. AV node, B. SA node, C. Purkinje fibers, D. Parasympathetic system. Answer is SA node. 14th one, making up stories to fill in the gaps of memory is. A. Reaction formation, B. Sublimation, C. Confabulation, D. Lying. Answer is confabulation. So we are making stories to fill the gaps of memory is called confabulation. 15th one, hemiplegia involves A. Paralysis of both lower extremities, B. Paralysis of one side of the body, C. Paralysis of both lower extremities, D. Paralysis of upper and lower extremities. So answer is paralysis of one side of the body. So what is the difference between paralysis and paralysis? Paralysis means just the weakness. Paralysis means the patient cannot move the affected part without any help. So paralysis means just a weakness. So hemiplegia means it is the paralysis of one side of the body. So answer is the one side of the body. So paralysis of one side of the body. Answer is B. So option B, hemiplegia. Then 16th one, first neonatal movement felt by mother is termed as. So first fetal movement, not the neonatal movement, first fetal movement felt by mother is termed as A. Lightening, B. Quickening, C. Bellowment, D. Engagement. So answer is quickening. First fetal movement felt by mother is termed as quickening. 17th one, normal head circumference in a newborn is. Answer A. 30 to 32 centimeter, B. 30 to 34 centimeter, C. 33 to 35 centimeter, D. 34 to 36 centimeter. Answer is 33 to 35. 18th one, VP shunt is the surgical management for. So ventriculoperitoneal shunt is the surgical management for which condition? Answer A. Spina bifida, B. Brain tumor, C. Hydrocephalus, D. ASD, atrial septal defect. Answer is hydrocephalus. 19th one, tumor of blood vessels of brain is. Tumor of blood vessel. So we have to be very careful. They are asking for tumor of blood vessel of brain. Answer is glioma. B. meningioma. C. hemangioma. D. astrocytoma. Answer is glioma. 20th one, the time of ovulation correspond to. So, the time of ovulation correspond to, answer option A, oxytocin level is high. B, blood level of LH is high. C, progesterone level is high. D, endometrial wall is loughed off. Answer is progesterone level is high. Answer is progesterone level is high. 21st one, sudden fall of temperature is called dash. A, crisis. B, lysis. C, relapse. D, quotidian. Answer is crisis. Sudden fall of temperature is called. 22nd question, which of the following solution is isotonic? Answer is 0.9 saline, B, dextran, C, 0.45% saline, D, dextrosaline. Answer is 0.9% saline. So, isotonic solution is 0.9% saline. 23rd one, MACEWEN. 23rd question, MACEWEN sign is an indication of A, cerebral palsy, B, mental retardation, C, hydrocephalus, B, meningitis. Answer is hydrocephalus. So, MACEWEN sign only seen in hydrocephalus. MACEWEN sign and hydrocephalus. Please try to remember MACEWEN sign related to hydrocephalus. 24th question, type of speech in which one repeats what the other have just said is. Carefully listen to the question. Type of speech in which one repeats what the other has just said is. A, neogolism. B, echopraxia. C, echolalia. D, association. Answer is echolalia. Answer is option C, echolalia. So, type of speech in which one repeats what the other have just said is option C, echolalia. 25th question, which of the following is an osmotic diuretic? So, which one is the osmotic diuretic? Answer is Lasix, B, spironolactone, C, aldactone, D, mannitol. Answer is mannitol. So, osmotic diuretic is mannitol. Mannitol will comes under the category of an osmotic. 26th one, what does P wave of an ECG represent? A, ventricular repolarization. B, atrial repolarization. C, ventricular depolarization. D, atrial depolarization. Answer is atrial depolarization. Atrial depolarization. P wave, atrial depolarization. 27. ALMA declaration was made in A, 1948, B, 1978, C, 1967, D, 2002. Answer is 1978. ALMA declaration was made in 1978. 28. Ghon's foci is seen in. Ghon's foci is seen in which condition? A, rheumatic fever. B, measles. C, renal tumor. D, tuberculosis. Answer is tuberculosis. So, Ghon's foci specifically seen in tuberculosis. 29th, palliative care means A, pain and symptom relief. B, general care. C, ostomy care. D, none. So, palliative care means answer A, pain and symptom relief. Palliative care means we are caring for the patients for pain. That is palliative care. Last question, invertogram is one of the diagnostic tests in A, pyloric stenosis, B, induced susception, C, anorectal anomalies, D, diverticulum. So, A, pyloric stenosis, B, induced susception, C, anorectal anomalies, C, diverticulum. Answer is anorectal anomalies. Invertogram is one of the diagnostic tests in anorectal anomalies. Thank you for watching my video. Please subscribe and support.